Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Hello, good morning, good afternoon, good evening, everyone. My name is Arash Rashidian. I'm Director of Science, Information and Dissemination in the Regional Office of the WHO in Emro. I have the pleasure of just saying a few words at the start of this important launch. As you know, we are launching under the leadership of Dr. Al-Mandari, and by his words, an important training resource for evidence-informed policymaking. And it is in line of the work that has happened since the decision of the Ministers of Health of the region in 2019, and we will hear about that more in a few minutes.
جزاك الله خير دكتور راش. Thank you very much. بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. رمضان مبارك. تقبل الله منكم الصيام والقيام وصالحات الأعمال. Thank you very much, Arash, for inviting me and giving me the chance to come and join you in this important meeting. Looking forward to hear from you, inshallah, for the recommendations and the actions to be taken and the way forward. And I'm sure this will be followed up by a very strong commitment from all member states and definitely from us to make sure that whatever science we come across, whatever information and knowledge that we gain from different experiences that we have gone through or different researches that we do will be really taken forward and implemented on the ground by those who are considered as decision makers and facilitate the actions of those who are frontliners, in the field. So thank you very much, Arash. Wishing you a successful meeting. Distinguished colleagues, ladies and gentlemen, it gives me great pleasure to welcome you to this launch event for WHO's new comprehensive training package to build capacity for evidence-informed policymaking in the Eastern Mediterranean region. Support to enhance technical capacity for evidence-informed policymaking is one of the most frequent requests we get from WHO member states in the region. They understand that they can only achieve universal health coverage and the health-related sustainable development goals if they develop and implement effective policies based on the most reliable and timely evidence. A commitment to evidence-informed policymaking is therefore at the heart of WHO's global strategy, the 13th General Program of Work, and our vision of health for all by all in the Eastern Mediterranean region. This new training package is the latest step in an ongoing program of work to boost evidence-informed policymaking for health in the region. In 2019, WHO's main governing body in the region, the Regional Committee, endorsed a framework to strengthen national institutional capacity in this area. And since then, we have been working methodologically with the national focal points to implement the framework. Much of this work involves making best use of the wealth of data and evidence that already exists in our region and beyond. For example, we have established a regional network of institutions for evidence and data to policy, which brings together 30 member institutions from 21 countries to share their experiences and leverage their knowledge and wisdom. The training package that we are launching today continues that approach of seeking to build on what is already available. It is designed to enable policymakers and academics tap into resources to meet their specific needs. As my colleagues will explain, a flowchart tool on WHO's website will help users articulate their needs and guide them towards suitable training resources available from all around the world. In this way, WHO is using our own limited resources to deliver maximum added value to countries. Let me take this opportunity to thank my colleagues in the Regional Evidence and Data to Policy team for this important and major initiative. And I also thank all of you for joining us today to this launch. I am sure that the new training package will stimulate further effective action on evidence-informed policymaking in the region, and look forward to receiving your feedback, recommendations, and success stories in due course, inshallah. Thank you very much. I wish you a very successful meeting, Arash and the team, and a very fruitful discussion. Jazakallah khair, back to you.
Okay, as I mentioned earlier, my name is Arash Rashidian, and I have the pleasure to give a bit of background about this important resource that Dr. Al-Mandari referred to. As you all know, I mean, this is a regional initiative that has happened as a result of this decision that the Ministers of Health took in 2019 in support of evidence-informed policymaking, specifically asking the WHO to help countries to institutionalize, to establish the resources needed for evidence-informed policymaking further in their countries. So all of you are familiar with this sort of picture here. I'm not going to the details of that in a way, but this is what we call the integrated multi-concept approach, which brings all the programs together for evidence and data to policymaking. Right now, our focus is on a web resource and its guiding flowchart that is actually a massive expansion of our capacity for training, opportunities for evidence-informed policymaking. As I mentioned, and as Dr. Al-Mandari referred to, in 2019, there was a technical resolution on evidence-informed policymaking topic for the region. Within that, the resolution was asking for technical capacity building program. It was followed with the development of a regional action plan that has a lot of details in terms of action, process that should be done. Within that, the technical products and development of priority technical products for areas for which a very clear guidance is not already available, but also, most importantly, holding training programs. Some of you are aware of those that is already happening. There has been several, I would say, in the last couple of years, capacity building events at the regional level, so especially focus on policy brief development. We've had the sort of what we call introduction to development of those policy briefs, so main principles. We had a recent one on the issues related to the, what we call it, advanced technical capacities required for development of policy brief. And then we are also, we finalized the plan, and we are hoping that we will do that very soon. One advanced training workshop for policymakers on how to use and how to request development of policy briefs for their decision making. There are also the issues of the discussion with countries about tailored and needs-based capacity building workshop for each country. So that would be according to the country request. But this will be also conducted based on what we do in terms of the institutional capacity building in the countries. Right now, this year, we have 3 countries as priority countries. One of them is Somalia, and we will listen to the WHO representative in the country, Dr. Malik, very shortly about how he feels about the resource and what are the plans for the country in that sense. And lastly, this the web page, which is the focus of the talk today and the launch today. So in a way, the development of the web page resource is due to the recognition that no matter how many training workshops WHO conducts, the needs of the countries are bigger, and the needs of the individuals who are involved in these processes, as the researcher who develops the evidence, or who assesses the evidence, or who develops the policy recommendation, the needs of the policy developers within the ministries of health, and also policy makers themselves are bigger and may not also match the timing of the training events. Even if you think of cascade of trainings, we need to have resources that people can refer to when they need at the time that suits their availability, and tailor their sort of the training programs according to their needs and requirements. So this web page, this is the aim that we would like to see. This is what we want to see out of it, so that people can go to it and find their needs and sort of benefit from the resource. But to do this, there was actually a meticulous program, so we didn't take it lightly, and it has happened over the last several months, starting from last year. As it was mentioned, it follows the resolution in 2019. So the most important thing was that to ensure that whatever is written in the technical paper behind the resolution is well understood, and we have a sort of, we are covering those issues in a technical manner. So if you refer, for example, on management of conflict of interest within evidence-informed policymaking processes, so then what do we mean by that? What are the steps? What are the technical elements that need to be considered? If we discuss rapid review processes, if we discuss sort of use of health technology assessment. So those areas I'm not saying that these capacities do not exist in the countries. Some countries, they have plenty of resources there, but bringing all of them together, but also ensuring that there's also the language and terminology become linked together. So based on that, then we searched for available training material. We gave a lot of attention to well-known, well-reputed institutions globally who are involved in evidence to policy processes, seeing whether they have training materials, and then we widened the search as it went to cover the gaps in terms of every key area that was important for us. Overall, over 140 potential training materials, some of them single material related to certain needs, but then some of them a group of materials, a package of training that was important. So all of these resources were reviewed and were shortlisted according to issues of quality, relevance, and ease of access to that. Is it free of charge? Is it available online? Those elements. And then to make it meaningful, we developed a sort of conceptual framework identifying 13 subject areas and then categorizing this training material under the subject areas. And then lastly, was working on the presentation of it, developing a guiding flowchart, developing the web resources. And this has been the thing that is still ongoing. We hope that we can even improve it further, but then has already taken a lot of efforts to make sure it is useful and meaningful. And we listen to Dr. Khairanish later on, and she will describe those issues. And then we are adding also WHO work there. So those workshops that I mentioned before, so for all the material of those workshops, the presentations, the slides, the voice, the documents are also being added. So if you have missed that workshop, you can actually go there and receive everything. So the subject areas are under 13 categories, as I mentioned. So about the knowledge translation processes, conflict of interest management, critical appraisal, up to the development of health technology assessment and clinical practice guidelines. So that would sort of, if the need is either of those, then you can go and find what is available. And then lastly, this is my last slide here. There is a flow. So when you go to the web page, to the link, you click, you see this sort of flow chart. And then there are questions. Are you a policymaker? Are you a researcher? And then what is your needs? And then it guides you through what you need to look at and what are the important elements that you need to sort of follow to respond to your training or capacity building requirements. And you can actually also use this tool for your team members to guide people to the resource and benefit from it. And our aim is that we actually use your feedback when you've used it, and if you have queries, if you raise sort of ideas, or if you can inform us of further capacity building program, we will update it and make it also available to everyone. I stop here. Many thanks indeed for listening. And now I have the pleasure to invite Dr. Mehnaz Khairanish. She's the Regional Advisor for Evidence and Data to Policy in the Regional Office. Dr. Mehnaz, the floor is yours.
Thank you for participating in this event. I will briefly introduce the training packages that RD and Dr. Arash mentioned, and also I will present some of the examples of these packages that we have in this product. Okay. These training packages categorized in 13 subject areas, as mentioned by Dr. Arash, which we believe that they can address all key policy questions that raised during the policy making process. And policymakers, policy developers, and researchers, all of them can benefit from these training packages that develop in this product. Also, there are resources from WHO as well as other institutions and organizations which are non-WHO resources. And also, I would like to mention that most of the packages and training materials that included in this product are free of charge and publicly available to all users. So we all of us familiar with these 4 key questions for policy making process. As we know, when we go through policy making process, there are 4 categories of questions that raise, starting with what is the main priority issue, what are the main problems, followed by what are the policy options, effective, safe policy options available to for that policy problem, and then we have the questions on what are the cost-effective policy options? Are they affordable? And we finally will have questions on the feasibility, sustainability of implementation of those policy options. So these are the 4 key categories of questions that we face during the policy-making process. And when we talk about evidence-informed policy-making, we're talking about how evidence can be used to inform these questions, to inform policy-making process by addressing and answering to these questions. So in our product, in this training packages product, as mentioned, that there are 13 subject areas. Some of them, as you can see on the left side in this slide, which are policy briefs, the package for policy dialogue, conflict of interest management, knowledge translation processes, and communicating evidence. These are the 5 packages that you can use them to answer all these 4 categories of questions. I mean, for example, we know that policy briefs is a product, is a key tool that can address the questions raised in the first phase, first 3, and the first 4 of the policy making process. But also we have some packages which mainly are categorized to a specific category of questions. For example, we have policy priority setting package, which includes training materials, different training materials that can help you, that can support you to increase, enhance your knowledge, to be able to go and to conduct policy priority setting. Also, we have, for example, 4 packages, as you can see here: systematic reviews, clinical practice guidelines, rapid reviews, critical appraisal. That these are the packages that can be used to answer the questions in the phase 2 and phase 3. Also, we have cost analysis, economic evaluation package, as well as health technology assessment, which these 2 packages can help us to find, to conduct, to do the cost effectiveness analysis, the affordability of the policy options, as well as to see the feasibility and sustainability of the policy options. And the final, the package is policy implementation evaluation, which includes the materials which can be used for policy options, feasibility, and implementation considerations. So, as showed before, this is the image. This is the guiding flowchart that we have, and you can find it through this link. I also put the link in the chat box for your kind reference. That this is the guiding flowchart that we have, using some questions that, but through these questions, you can find the most relevant package, the most relevant training materials to your question and to your needs. So, I just want to go through 3 scenarios. Of course, there can be many other scenarios that these training packages can be used to answer the questions for different scenarios. But also, we believe that this package can be used to enhance our technical capacity building in general, to just enhance our knowledge in evidence-informed policy making and policy making processes. So I want to just introduce 3 scenarios. The first one, just imagine that you are a policy maker with a limited resources, and you should do the policy priority setting to prioritize the health problems. The second scenario will be you are a policy developer requested to identify the policy options to enhance implementation and use of clinical guidelines by private sector. And the third scenario will be you are a researcher and there is a question raised by policymaker that what medicine, medicine A or medicine B, should be added to National Direct Formulary. So now I want to go through this link. So using that, the link, you will face this guiding flowchart, which have a start point and end points, 2 endpoints at the end. There are questions that by using these questions, you will find the most relevant training packages to address and to answer your needs and your requests. So let's back to the scenarios that we talked about. So the first one was you were a policymaker and there are plenty of health problems in front of you and you should go for policy priority setting. So you have a strategic role in this regard. This is the training package that you can use it, the policy priority setting package. By clicking on this package, you will enter the training package as you can see here. For all of the packages at the beginning, we have the kind of brief introductory of the package, as well as the key objectives of the materials, different materials that included in the package. I would like to mention that in each of these subjects, we have different types of materials, including online courses, offline workshops, web-based courses, as well as some guidelines, tools, textbooks that can help you to enhance your knowledge about that specific subject. So, for example, this is the policy priority setting package. If you can see, we have two categories of materials. Some of them are main materials, and some of them are supplementary ones, which this is the same for all packages. We believe that the ones that we included in the main materials, the main categories, these are the training programs, the training materials that can be used to have enough knowledge about the topic. But if you want to learn more, to go for further sources, you can go and use these supplementary materials as well. So for each material, we can see the topic, its source, the title, including the link to access to that training program, the format, and also the time which is needed to start and end that material. So these are the options that you can find here. So you as a policymaker, by going through one of these items, this is 1 hour, 1 to 2 hours, or 2 to 3 hours, as well as some text material, the supplementary ones, we believe that you will have enough knowledge to go for policy priority setting. Let's go back to the second scenario, which was you were a policy developer. You were requested to identify the policy options to see how you can enhance use of guidelines, clinical guidelines by private sectors. So we know that the best tool for presenting policy options for a specific problem to a decision maker is policy brief. And policy brief, so if you want to develop a quality policy brief that have buy-in from a policymaker, this is the package that you can use it. This is the package for policy brief development and use. As you can see here, again, we will have a brief introductory, the objectives of the material included in this for this subject. And there are also some main and some supplementary materials. For example, policy brief, we have materials for how you can develop a policy brief, as well as we have some materials that how you can use and appraise the policy options presented in the specific policy brief. If you are a policymaker and you want to appraise them and you want to use the policy options, you can go and see here the materials that can help you in this regard. As Dr. Rashidian also mentioned earlier, we now in EMRO, we have been planning for different variety types of training programs that, including some workshops that we uploaded, and we are also uploading some and their recordings, the presentations, also in these training packages. So if you couldn't, able to attend our workshops, you can find the materials here. For example, this one is the recordings and materials for the policy brief development workshop that we held in December last year. And again, let's go back to the third scenario, which was you were a researcher, and there was a question from policymaker that what medicine A or medicine B, should include in the national drug formulary. So to answer these questions, you need to go for somehow economic evaluation methods that you can find them here, or HTA. So for HTA, if you want to contact HTA, Or if you want to see that there are HTA, relevant HTA available at international level, which conducted by other countries, and you want to use and transfer the results of those HTA to your own country, to your own context, you can go through this package, which is health technology assessment. Here we have two types of materials. The type that can help you to raise your knowledge for conducting a local HTA study, as well as the materials that can help you to how to transfer, to adapt the results of HTA conducted by other countries to your country context. As I mentioned before, there are some supplementary materials that can be used for just for learning more or having some more references reviewed. So at the end, I also want to mention one important point from our side. Bottom of this, training packages, you will find two key here, as you can see, which by clicking on them, you will find the form. One of them is just, we want to have your feedback, your comments, your suggestions on the package or packages that you will use. So please put, just by filling this form and submitting, it will directly go to our email box, and we'll review it, and we'll use your comments, your feedback, your suggestions to improve this package. Also, I would like to ask you that, we have another, button here, which is for if you face any difficulties, any issues in using these packages, or you have any kind of complaints, please fill this form and again submit. It will directly go to our email box, and we believe that, by having your comments, your feedback, we will, improve these training packages as much as possible. Thank you for your kind attention. I will stop here and get back to you, Dr. Arash. Thank you.
Many thanks indeed, Dr. Khalanish. That was excellent. So now I have the pleasure to invite Dr. Malik. As I mentioned, he's a WHO representative in the country Somalia. And from that perspective, we would like to hear from him that how WHO supports in enhancing their capacity for evidence-informed policymaking, and how this resource might be of help to the country. Over to Dr. Malik.
Thank you, Dr. Arash and colleagues. Let me just begin by saying that Somalia was once the white pearl of the Indian Ocean. The country inherited a weak post-colonial healthcare system on 1st of July 1960, when it gained independence. Even in that time, the rural pastoralist and nomadic populations had very negligible access to essential healthcare services. The civil war, which broke out in 1990s, led to tragic destruction of its healthcare system, pushing the countries to its margin. The transition to recovery began in 2010s with the institution of a transitional federal government. However, every time the country wanted to rise from ashes, its recovery was pushed back by a spiral of famine, drought, and civil strife. The COVID-19 pandemic made the things from bad to worse. But WHO stood firm on the ground and did not leave the country to solve the country's massive public health problems by itself. Knowing that the country had limited operational capability to manage pandemic of this magnitude and nature, WHO became the country's X factor to do the job together. It also gave us the opportunity to use and translate knowledge to build back better. A new institution called the National Public Health Institute, which was enacted by the National Parliament back in 2017 or 2018, came to surface in late 2020 with a vision to build its public health workforce and strengthen the country's fragile public health system using science, evidence, and knowledge. It has proved to be a game changer. WHO strongly collaborated with the National Institute of Health to help them emerge as a sign of hope for their country and also for our own learnings too. After a year and a half from late 2020, WHO's support and engagement with the National Institute of Health has seen a number of landmark achievements. In a very weak and fragile federal government structure, the NIH is seen in the country as the most trusted force to build its operational public health capacity. WHO is also supporting the NIH to build and maintain the IHR core capacity of the Somalia, which is currently at 33 out of 100, moving from 22 only in 2019. The NIH is recognized as the main driver for building country's public health workforce. They have introduced the frontline health workforce pyramidal model training, leading towards the field epidemiology training program in the country. The NIH also organized the first ever National Health Research Conference in January 2022, which was attended by over 183 participants presenting over 50 abstracts. The fact that 3 ambassadors, the WHO representative, and the Federal Minister of Health were all together in the same conference speak of the value and importance of this research conference. At last, we have seen science and data have triumphed and have taken the front page instead of security and conflict. Today, the NIH functions cover disease surveillance, public health laboratories, emergency operations center, research, and health workforce development. It is the knowledge center for the future policy and practice that will shape the health sector of this and its national health security. Our strong engagement with NIH to drive evidence-informed policy setting and practice has seen CDC, the Sweden Public Health Agency, Alliance for Health Policy and Systems Research, African Field Epidemiology Network, African CDC, and a host of other regional centers collaborating with them and funding their activities. In closing, let me say an African proverb. If you want to go fast, go alone. If you want to go far, go together. We have aimed to go far. Our partnership and engagement with the National Institute of Health in Somalia mean we are here to use our convening power to support one of our key member states to enhance its capacity for evidence-informed policymaking and sustain it for the country's own aspiration to achieve universal health coverage. More broadly, our support has given the NIH a broad range of confidence, pride, and belief in national institutions and on its progressive abilities to use knowledge, science, and evidence to build their own health system that serves the need for all and not few. If we turn the clock back to 2 years from today, Somalia had no testing facility for molecular diagnostic, no laboratory with a real-time PCR for testing COVID-19. Today, the country has 3 laboratories with genome sequencing capability and 7 BSL-2 molecular diagnostic laboratories across the country. From nowhere in 2020, today, the country has embarked on its field epidemiology training program, beginning with developing its public health workforce with frontline health workers. What has changed in these days is leadership and authority shown by the NIH in driving the country's health reform agenda. I believe the more the NIH will resort to science and evidence and apply this to policies and practice to reap benefits for population health, the history of Somalia will be written differently from being one of a fragile state to one of hopes and promises. I think Somalia today is on the right trajectory as they're moving away from dependence on external aid to a data-driven policy and placing health research and data science at the center of their health reforms. We see value in partnering with NIH. Our goal of achieving triple billion targets and the regional director's vision of 2023, health for all and by all, can only be achieved if we have technical partnership and networks with strong national institutions who can deliver on promises and whose tenet is formatively leaned towards building evidence and using those for affordable policy and practice. Finally, the contribution and resources offered by the Division of Science, Information, and Dissemination to this NIH of Somalia, especially Dr. Mehenner's almost daily engagement to NIH to transform this process has been key to the success that we see in Somalia today. Thank you very much for giving me this opportunity to talk about a success story which we share together. Thank you very much.
Many thanks indeed, and I'm really grateful, Dr. Malik, that you actually made your presentation the way that WHO works. You said it from the way you see how the country is progressing and how the institutions of the country are acting on that ground. And I'd like to say, as you mentioned, I mean, the NIH is a member of the Net2P network of the region as well. So one of those key institutions that we hope will benefit from the network, but also will, by sharing experience, will benefit other members of the network together. So working together, this is the way to go. Many thanks for your excellent presentation and remarks. So now I have the pleasure to invite another distinguished colleagues. So I'm inviting Dr. Abdelia Marnisi, who is the head of Planning and Studies Division within Ministry of Health and Social Protection in Morocco. Dr. Marnisi is actually, I would say, a close friend over the years. He's a close friend of the WHO. In different positions he has had, excellent relationship. The work he's done in terms of data for the country for over many years. Now he's in a position to be in the charge of making sure the data is used for planning and the evidence to policy process is strengthened. So Dr. Marnisi, the floor is yours and we are ready to listen to you.
Thank you, Dr. Rashidian. Good morning, everyone. Your Excellency, Dr. Ahmed El-Mandari, Regional Director of WHO for the Eastern Mediterranean region, ladies and gentlemen, it is a real pleasure for me to participate with you in this launch meeting of comprehensive training package for capacity building for evidence-informed policy making. Ladies and gentlemen, the health system in Morocco is facing many structural challenges, limiting the achievements of its objectives efficiently. The COVID-19 pandemic, which has disrupted all health systems around the world, has intensified these challenges and forced out countries to accelerate undertaken reforms. In this regard, an in-depth reform of the health system has been launched, which is based mainly on 4 pillars: implementing a new governance of the health system, strengthening human resources, strengthening and upgrading the healthcare supply, and the development of an integrated health information system based on shared medical record. Besides this, Morocco has launched an ambitious project of generalization of social protection to the whole population, extending the health insurance by the end of 2022 is a key component of the project and a decisive step towards achieving UHC. However, implementing with efficiency the different reforms requires evidence. At national level, we need more than ever evidence to inform health policies and decision-making process. Currently, a lot of health data is collected and a lot of health researches are carried out, generating evidence, which can help to address these challenges of the health system and contribute in building a solid health system. But often health research and decision-making remain disconnected, important policy issues remain unaddressed, and sometimes evidence does not reach the decision makers, therefore opportunities to improve the health system are missed. For these reasons, implementing successfully the different reforms requires to build national capacities on the use of evidence in health policy. Enhancing technical capacities is a key element to develop appropriate and effective health policies. For example, since the adoption of 2030 agenda, Morocco has made significant progress in many health targets, but evidence-informed policymaking remains essential to accelerate the achievement of health-related SDGs and universal health coverage. I am sure that this comprehensive training package presents important resources for strengthening technical capacities and skills on different topics, supporting the use of evidence in health policies. I believe that these resources will meet the need of policy developers at national level and researchers and be highly used and appreciated mainly at the National School of Public Health, which train managers in the public sector and health policy developers. I believe also that economic evaluation in public health, such as cost analysis, conducting HTA, and also preparing policy briefs are some examples of priority tools for developing health policies, particularly in this context of reforms. In conclusion, I would like to congratulate the WHO team for developing these relevant and quality resources, which will surely contribute to improve the use of evidence in health policy development, which are crucial for achieving national health objectives, health SDGs, and UHC. Thank you.
And many thanks, Dr. Manisi, for excellent remarks and also for your feedback about the process. I'm really delighted to say that WHO is working very closely with Ministry of Health and in Morocco in terms of evidence to policy processes, with the National School of Public Health, as you referred, and also with other institutions in the country. And we really hope that, I mean, with Morocco, we will be able to show a good example of how the processes can be implemented, the lessons we learned from the decision of the ministers, and also the best practices available globally to support policymakers in use of data and evidence. So many thanks for these remarks, Dr. Manisi. Now we have, according to agenda, about 4 minutes for questions and answers before I invite Dr. Rana Hajje for her closing remarks. Okay, very good. If we have no question, I think we can immediately listen to Dr. Hajje, who is the Director of Program Management within the Regional Office of the WHO. I know if you are not part of WHO, that term may not be very clear what it means. It effectively means that her role is to lead all technical programs of the WHO and that come together. So making sure they are coordinated, collaborating, and also guided so that they respond to the needs of the countries the most effectively. In that sense, I would like to ask Dr. Hajje to give her remarks and also close the session. Thank you, Dr. Hajje.
Thank you very much. And I hear RD is still online. Thank you very much. Good afternoon, RD as well. And thank you very much, Arash and Mehnaz for organizing this really important training. Sorry, I couldn't join at the beginning because I was on another webinar and actually, I will tell you in a minute about the webinar I was on because it's a great application for this training. But I had the chance to join during the last part of Mehnaz's presentation and to also listen to the experiences from our WR in Somalia and from Dr. El-Marnisi in Morocco, which is great and really good to hear about country experiences. I think a lot was said. I know RD had mentioned this in his opening remarks. I think we cannot, as scientists, as epidemiologists, as public health professionals, I don't think that we need to preach to you about the importance of sound evidence and how critical it is for policymaking. We have known this all along for any public health priority, but I think the COVID pandemic in particular has even further highlighted the importance of having this strong capacity in all of our countries and to be doing it in a very systematic approach, not as ad hoc. So, I think we have already, as you have heard today, many good examples from our countries. We think now more than ever, evidence is becoming really critical to strengthen overall our health systems for two main reasons. First, to make sure we reach our goals of universal health coverage, but also after COVID now it's becoming even more present every day, the importance of reaching global health security. And as we saw during the pandemic, many countries struggled by having the right evidence to support decisions, good evidence-based decisions to make really major decisions that were even putting whole economies. It's not only about health, because it became very clear during the COVID pandemic that the decisions that are made by the health authorities were critical to the society overall. So that's even put in a broader context. So I'm really happy that over the last now it's been almost 2 years that we have established this evidence and data to policy unit first. So we welcome Mehnaz as the first regional advisor, but also the whole network that is currently being established and expanded in the region. And this training that is provided today is part of our efforts as a regional office, working closely with our country office, with all our other colleagues in order to strengthen this. As I'm sure RD mentioned it, we believe here in the region in health for all by all. So the critical role of all of the partners is really important for this process to take place. And for us to actually be able to make this kind of training institutional so that it becomes part of the day-to-day work and the systematic approach to making the right policies. We know that without the right policies, most public health interventions will not be able to be successful. Of course, the policy itself is not enough. We also need enough implementation and support to make sure it becomes operationalized. But the first step is to make sound policies based on strong evidence. And in this regard, I also would like to highlight the importance of strong data, because without data, we cannot make evidence-based decisions. And without strong health information systems, we cannot generate good data. So that really puts actually the whole mission of the department that is headed by Arash, for information, science, and dissemination, puts it all in the context of how all of this will be able to support evidence-based decisions. So I hope you found this webinar helpful. I actually found it very interesting, and I hope that this training package that will be easily available online with all the support of our team will really boost the country's capacity to build that evidence-based capacity and to support additional and stronger public health interventions in the region. So I hope you will be able to take full advantage of it and to let us know if we can continue to support you in any way. So thank you all very much. Thank you, Arash, over to you.
Many thanks, Dr. Hajat, for your kind remarks and closing remarks. So thank you, colleagues, for being with us. I am really grateful to all colleagues behind the session to organize it. I mean, IT team and also admin support that have made it possible for all of us to work so well. But I'm most grateful to colleagues who have been with us through the hour. I've seen several senior colleagues from different countries of the region. We are heartened with your positive remarks that you've given, but we will also benefit from critical analysis that you will provide, any comments you have. We really want this to be your support, for the support that you provide to others. So any feedback you can give on that would be really good. And as I mentioned at the start of the session, this is part of the journey we are going together. So hopefully we will also enhance the process as we go forward. Okay, many thanks again. And with Dr. Al-Mandari permission and Dr. Hajji permission, I'm now closing the session. Have an excellent day. If it's in the morning, the rest of the day, if it's evening. So enjoy your rest in the afternoon.
Jazakallah khair. Thank you very much, colleagues. Ma as-salama.